All right, welcome back. I have my friend here with me, Albert Einstein, as well as Shanae, PT that I work with, fellow colleague. Today we're going to review upper cervical ligamentous stress testing of the alar ligament. So just as a quick background of the alar ligament, it attaches to the posterior lateral side aspect of the dens and goes up in an oblique angle like a Y and attaches to the occiput or the skull. And the action of that ligament, and the Y ligament, sometimes it's referred to, is to resist the opposite rotation. So the left side alar ligament will get taut with right rotation. And so when you're testing this particular ligament to make sure that it's intact, what you're going to do is you're going to grasp the C2 spinous process, and you're going to actually side bend the head a little bit, and you want to feel that spinous process of C2 kick into the opposite direction of your hand. And that just has to do with concurrent actions of side bending and rotation of the occiput on C1. So it will tension up that alar ligament, and you'll feel the kick into your thumb going the opposite way, which just means it's intact, because as that alar ligament pulls, it's going to also pull the C2 vertebra in the opposite direction, and vice versa. So there's two positions that you can test this ligament in, and that's in sitting and in supine. And we'll show sitting test on Shanae here in a second, and then it'll be the same in supine. But again, what you're looking for is if you don't feel it kick into your hand, that means that ligament could be under stress, or it could be lax, or there could be a potential risk for that ligament to be torn. Now, you're also looking for those cardinal signs and symptoms when you perform those head movements. Are they getting dizzy, nauseous, having those responses that are more of a red flag type of issue? And then that's one where you want to really be cautious with what you're doing with this patient in the upper cervical region. That could even involve head movements and positions as well. So let's take a look at the test in sitting. So I'll get Albert Einstein out of the way, and we'll use Shanae. And if you wouldn't mind turning around the other way. So in this position, you just kind of grasp C2, and what I'm feeling for on either side of the spinous process in that position, and all I'm doing is side bending her head, and I feel that kick into my thumb. So I side bend it left, I feel it poke into my thumb on the right side, and then vice versa, and it should happen almost immediately. There's less than 5 degrees of side bending motion where you'll feel that kick into your thumb. So hers are intact, and I like that. Another way you can do it is if you go ahead and lay down, Shanae, head down here. We'll raise this up just a little bit. Okay. The other way you can do it is if you can also get her in supine. Same thing. You pinch the spinous process of C2, and you just do a little bit of a side bend, and you should feel that kick left to right, opposite of the side bend. And hers are intact. So nothing to worry about there. If you do all that testing and it's negative, you're safe to do any treatment manually, manipulatively of the upper cervical spine. Thanks.